My name is Stephanie Brad, and I'll be presenting on dwarfism and its relation with adapted physical education. Dwarfism is an umbrella term that describes a condition of short stature and is often associated with hormonal, nutritional, or psychosocial problems. Statistically, 1 in about every 200 people are affected by dwarfism, and about 80% of people with dwarfism are born from parents of average size with no family history of the condition. The average height of an adult with dwarfism is typically 4 feet 10 inches or under, and dwarfism can be medical or genetic. And people with this condition prefer to be called little people. Dwarfism is caused by genetic mutation, and there are 2 categories: proportionate and disproportionate. Now, the causes of proportionate dwarfism are metabolic and hormonal disorders, such as growth hormones. On the other hand, it is a condition with abnormal bone growth that causes disproportionate dwarfism. The most common form of dwarfism is achondroplasia, which occurs in about 1 out of 26,000 to 40,000 babies and is evident at birth. Now, this form of dwarfism is the absence of normal cartilage formation and growth, which begins in the utero. Characteristics of this form of dwarfism is that individuals will have a long trunk, shortened upper parts of the arms and legs, a large head, and a prominent forehead. Curvature of the spine, bowed legs, flat, short, broad feet, and they may have double jointedness. Other forms of dwarfism include SED, which is a less common form and refers to conditions characterized by a shortened trunk. This is very rare and occurs in about 1 in 100,000 births. People who tend to have this form of dwarfism have shortened forearms and calves, deformed hands, limited range of motions, and cleft palate. Now, some people with dwarfism who do not have achondroplasia might have cervical vertebrae abnormalities similar to instability in Down syndrome, which might lead to serious neck injuries. Now, some form of dwarfism is evident at birth or during infancy and might be diagnosed through X-ray and physical exams. A diagnosis for many forms of dwarfism can be confirmed through genetic testings, and in some cases, prenatal testings are performed. Signs and symptoms to look for with dwarfism: late development of certain motor skills, breathing problems, bowed legs, joint stiffness and arthritis, lower back pains, or numbness in the legs and crowning of the teeth. Now, when dealing with children with dwarfism, physical educators should influence children to participate in physical activity, as this will help promote motor skills and patterns Children with dwarfism are at a disadvantage in most sports, and so modifications by the physical educator might help. For example, putting a person of short stature, if playing soccer, to be the goalie. According to the Dwarf Athletic Association of America, people with dwarfism should be given the ability to perform in organized sports competitions and they should and in disproportionate dwarfism they should be equal to or less than 5 feet in height, and proportionate should be equal to 4 feet or less, and they are eligible for competition in organized sports. Now, early diagnosis and treatment can help lessen some of the problems associated with dwarfism. They could be treatment such as surgeries, physical therapy to strengthen muscles and increase range of motion, back braces to improve curvature of the spine, and exercise to help prevent obesity, which could cause skeletal problems.